Hello friends and welcome back to another fresh episode of your favorite show around technology जिसका नाम है Tech with TG and guys this is the show जहाँ पे हम एक दूसरे के दोस्त की तरह टेक्नोलॉजी के बारे में बात करते हैं. You know, every episode is quite fresh, quite new and quite exciting because I get to share कुछ knowledge आप सभी के साथ. Guys, knowledge essentially is equivalent to wealth. तो कहीं ना कहीं मैं आपकी wealth में इजाफा कर रहा हूँ with each new episode of योर फेवरेट शो टेक विद टीजी. बट मेरा क्वेश्चन ये है कि नॉलेज के ऊपर भी एक वेल्थ होती है. कैन यू आंसर कौन सी वाली होती है? Well, don't stress. I'll give you pretty easy answer. And guys, जो सबसे important wealth है, it is our own health. That's the reason we say health is wealth. अब देखो मैं philosophical reasons में नहीं जाऊँगा कि अच्छी health से क्या फायदा हो सकता है और कैसे हम wealth बना सकते हैं वगैरह वगैरह. But the simple thing is that our health is very important to all of us. And guys, इसी के लिए sometimes just to keep ourselves in good running condition, we go to hospitals for different checkups, for some treatments and वहाँ पे we have numerous different machines, कुछ नए नए medical equipments. मजे की बात, everything has some bit of tech involved in them. Guys, my name is Gaurav aka TG. You are watching your favorite show Tech with TG. तो जल्दी से आगे बढ़ते हैं, चलिए शुरू करते हैं. Now friends, as I said in today's episode, the idea is to talk about medical equipment. आपने अक्सर सुना होगा about let's say ECG. अब ECG क्या है? How does it work? What exactly does it measure? There's lot more to learn. Let's go behind the scenes and learn more while we discuss about these medical equipments.
Hello everyone, my name is Dr. Ashish Chaudhary. I am the Managing Director of Akash Healthcare Super Speciality Hospital, New Delhi, Dwarka. I am also heading the Department of Orthopedics at the same facility. Today I am going to talk about what medical equipment or the science and technology has a role to play in transformation of the healthcare delivery in India. Starting from way back in 1980s, 90s, when it was in a very primitive form and the medical equipment and technology had not entered into the healthcare space in such a big way, most of the work was done manually. Most of the surgeries or the treatment were done in a basic open manner where not much of technology was used. I still clearly remember when I did my first surgery way back in 2004. I clearly remember the kind of instruments which I was using, especially related to orthopedic surgery. In fact, we were using all manual drills to actually fix the fractures and do some joint replacement and other procedures. And those were so primitive that a procedure which now takes hardly 15 minutes, we used to take almost two hours plus to actually do that surgery, and that too with a bigger incision, more morbidity and problems to the patient, complications after the surgery. And from that particular era to today, where we see robotics coming into play, almost entering every operating room, augmented reality solutions, AI and machine learning applications, and there are hordes of software applications which are making the life of surgeons, doctors, physicians much easier, and so that they can take the right decision for the patient's treatment and also at a very fast pace. Talking about few technologies, robotics scores very high in today's time, where not only the orthopedic surgeries like joint replacements are being done through robot, but complex surgeries like Whipple's procedures, the weight reduction surgeries like bariatrics procedures, head and neck cancers, and many such procedures are being done through a soft tissue robot which has been there for almost like more than a decade. It's called DaVinci robot. So robotics, without doubt, has taken a big place in every healthcare system, and it's proving great results for patients and bigger satisfaction index and at the end of the surgery, surgeon feels much more accomplished and he feels he has done a good job. Apart from that, if we talk about cardiology, the machines like RotaPro, rotablation, and a special cath lab system which is called a biplanar cath lab system has proven great merit over the conventional systems, wherein we get a three-dimensional view of the entire cardiac problems, and the intervention cardiologist is able to carry out the procedure with minimum amount of complication and drug usage and maximum benefit to the patients. Very recently, we have seen the use of 3D printing coming big way in many specialties, majorly orthopedics, neurosurgery, pediatric cardiac surgery, where the surgeons find they land up in a difficult spot in a complex case where they are not able to operate or find a right solution because there are no standard implant, no standard procedure available. So before going for the surgery, they really want to witness how the problem is going to be when they open. So for that, 3D printing has come very handy for all those complex cases where we can do a simulation surgery or I would say a virtual surgery outside the operating room, prepare our mind, prepare our hands and the thought process very clearly before we actually go ahead and do the operation. So this becomes very critical for a pediatric cardiac surgeon where the small heart is having a defect, and once they open, they are always racing against the time. But if they are prepared well before the operation, so the time wasted in deciding at the last moment, at the critical moment becomes very less, hence leading to a better outcomes of the small babies suffering from congenital heart diseases. Likewise, in our orthopedics, we do a complex spine procedure like a scoliosis procedure, which almost can take 6 to 8 hours. And there is a great risk of radiation exposure not only to the patient but also to the surgeon and the assistant team. With the use of 3D printed surgical jigs and technology, we are able to cut down the surgical time by almost half. We are able to provide very accurate jig system which can help us complete the surgery, put the implant in a very precise manner without causing any complication or harm to the patient. So likewise, many such specialties, endoscopies, arthroscopies. So there are multiple technologies which have found place in various specialties. You talk about gastroenterology, we have got endoscopes, colonoscopes. Almost every part of the gut now can be viewed as an office procedure, where you are sitting in your office, you want to check the upper GI system or you want to check the lower GI system. Within 10 minutes, you can prepare the patient and go and put the scope, and you can see on a big screen what is the problem. You can take a biopsy, you can do a treatment there, and patient can go back home within no time. And similarly, you talk about neurosurgery, we are able to do awake brain procedures. That's a very recent advancement in last few years. When we are doing brain tumors, we are operating, we don't know whether we are damaging the normal tissue. For that, we have an option to keep the patient awake, keep talking to the patient, and while the neurosurgeon is operating on the tumor, if we are touching any normal tissue, immediately we get to know with the patient's response, and thus while the patient is awake, he is getting the complete brain tumor surgery done and without any complication being delivered to the patient.
ब्रेक के बाद हम और डिटेल में डिस्कस करेंगे कुछ और इंटरेस्टिंग मेडिकल इक्विपमेंट्स के बारे में और जानेंगे कि आखिर वो काम कैसे करते हैं. एवरीथिंग कमिंग योर वे राइट आफ्टर दिस शॉर्ट ब्रेक. हेलो फ्रेंड्स, वेलकम बैक आफ्टर द ब्रेक टू योर फेवरेट टेक शो. इट्स टेक विद टीजी एंड ये एक ऐसा शो है जहां पे हम हमेशा कुछ टेक्नोलॉजी के बारे में इंटरेस्टिंग बातें डिस्कस करते हैं. मतलब चाहे वो बहुत ही सिंपल हो या बहुत ही कॉम्प्लेक्स, आवर आइडिया इज टू जस्ट गो बिहाइंड द सीन्स एंड लर्न मोर अबाउट द टेक्नोलॉजी. और ब्रेक से पहले हमने ऐसी कुछ चीजों के बारे में बात करी. अगर आपको लग रहा है कि लिस्ट खत्म हो गई है, नो, इट्स नॉट ओवर येट. लेट्स कंटिन्यू जर्नी एंड लर्न मोर अबाउट दीज मेडिकल इक्विपमेंट्स एंड understand what runs behind the scenes और ये आखिर काम कैसे करते हैं.
One very important thing which I would like to talk about is the DaVinci robot, which in a larger sense it's called a soft tissue robot. Now this robot has the capability to enter into any cavity across the body and try and give that kind of access to the surgeon, which a normal laparoscopy or an open procedure cannot do. So you talk about starting from the head and neck, where difficult lesions in the pharynx, behind the tongue, in the trachea, or around the neck. This all area can be accessed easily with the DaVinci robot. So all the tumors, all the infections, wherever it becomes very difficult to reach through the conventional methods, DaVinci comes very handy for the oncologist and the head and neck surgeons. When we talk about cardiac surgery, so robotic procedures through DaVinci, it can be done in a very small micro incision, wherein most of the young patients, they suffer from congenital heart disease like ASD and VSD defects. There are multiple defects which, unfortunately, through a conventional method, we have to give a complete separation of the chest. We do through a long incision in the center of the chest, whereas when we go use the DaVinci robot and have the special instruments, we can just put 2 small incisions on the side of the chest wall and just go inside, repair the tissue of the heart and come out. So that gives a very good cosmetic result, and also because the incision is so less, the recovery is much faster. Then we come to the GI system, where you can have diseases like weight loss procedures, gallbladder surgeries, liver problems, pancreas problem, and sometimes the intestine problem where there is an obstruction or blockage. Robot has the capability, there's called multiple arms which can go inside, talk to each other, and surgeon is sitting far away on a console, and through a distance they can manage all the arms. And the arms, the fantastic part about these arms are that they can go into multiple 6-dimensional directions, where a normal hand surgeon or a laparoscopy procedure will not be able to access. So that is the beauty of the DaVinci robot, and that's why even with a small incision they can reach far end of any part of the body, and that's how things become much easier for the procedure to be done by an experienced surgeon. Last but not the least, the area of prostate. Prostate surgery is becoming very common because prostate cancers, prostatitis, and so many urogenital issues are catching up in Indian scenario. So I feel that one of the very good indication for DaVinci robot would be the surgeries related to the prostate problem, prostate cancer, and because of the small incision, because of the precision in the DaVinci robot, we are able to carry out the procedure with minimum morbidity to the patient and best functional outcome. One very important thing with DaVinci is that since the surgeon is sitting far away from the arms, away from the patient, this has the potential to operate even across the continents. I'm talking about telesurgery, where the surgeon only manage through a console, maybe sitting in USA, while the surgeon's surgery or the patient is there in an operating room thousands of kilometers away, and through that console the surgeon can guide the local surgeon here and get the surgery done and provide the same expertise across the border. So DaVinci has not only improved the functional outcome, but it's going to be the future of all those complex procedures where one specialist can sit at his own location and can give advice, give support, and do a surgery right from his operating room, while the patients as far as 1,000 kilometers away, east or west of the globe, can get benefited through this technology and telesurgery. Let's talk about what is the future of this technology, how it's going to be seen 10 years down the line, 20 years down the line, what will be the adaptability across the countries and the globe. I can only say that the technology is here to stay. With every passing decade, we are seeing better and better adoption, and also it's a survival of the fittest. We have seen so many applications, software as well as hardware, coming into the market, dealing with the patients, dealing with the healthcare professionals, or trying to bring outcome changes in the healthcare delivery, but only that particular application or that particular technology survives the test of time, which actually changes the patient's outcome, which actually improves the surgeon's experience during the procedure. So I'm not sure if every technology will be adopted equally, but I can say somebody who has done a complete due diligence of the gap which is present here and then trying to fill up that gap with the right technology which can adapt well in the patient's in the surgeon's hand and bring about actual outcome change at the end of the day. So that's why it becomes extremely important to do the I would say the beta testing of the application or the hardware in a clinical scenario, and then see whether it is really making difference in patient's life or the outcomes of the procedure. That's why all the regulatory authorities, drug controllers, FDA, US FDA, all these agencies make sure that whatever is introduced into the market, whether it is a medical device or an equipment or an instrument or an implant, ultimately it has to be the first and foremost priority is that it should be safe for somebody who is getting the technology being used. So in fact in today's time, software has also been equally treated like a medical equipment, because software drives the a particular hardware, and that hardware actually makes or breaks or changes the course of treatment in the patient's outcome. So in fact time has changed. Not only anything which has to do with the patient outcome will be categorized as a medical equipment, whether it is a physical equipment or a device, or even if it's a software code which helps in running a particular hardware for the patient surgery, for the patient's outcome.
So friends, there you have it. मतलब आप खुद सोच के देखिए कि कितने सालों की मेहनत और नए इनोवेशंस के बाद में टुडे व्हाट वी हैव इन आवर हॉस्पिटल्स आर काइंड ऑफ दीज मशीन्स, जो कि एकदम स्टेट ऑफ द आर्ट हैं और काफ़ी एडवांस तरीके से काम करती हैं. कुछ के फंडामेंटल्स एकदम बेसिक हो सकते हैं, कुछ बहुत कॉम्प्लेक्स हो सकती हैं, बट आई एम श्योर आफ्टर टुडेज एपिसोड यू नाउ हैव अ बेटर आइडिया अबाउट ऑल दीज मशीन्स. गाइज, मैं आपसे मिलता हूँ अगले एपिसोड में विद इवन मोर फन, इवन मोर इंटरेस्टिंग things to talk about the field of tech. Till then, if you have any feedback, any questions, any queries, if you just want to talk to me, you know the email address जो है tg@ndtv.com. I'm gonna see you next week एक और फिश एपिसोड के साथ में. फिलहाल इतना ही. Take care and have a good day.